Hello, this is Dr. Eric Dover, back again with our second podcast of the Medical Mafia show. Uh, Hopefully you've seen our first podcast. This will be our second attempt. Hopefully this will be better than the last one. Anyways, today we're focusing on chronic pain. It's become a huge issue over the past 3-4 years. Um, there's obviously different sides of the debate. On the next show, what I'd like to do is actually bring in some folks either to the studio or do it over Skype and interview them in regards to their experiences with chronic pain, especially if they've had experiences in trying to deal with the medical board, the Oregon Medical Board in particular, in regards to these issues. So let me start off with, the story goes back a ways. There was a time, not too long ago, that opiates were being pushed pretty heavily. I'm not taking a stance whether it was right or wrong. I'm just saying what was being done. Medical boards were, at least here in Oregon, were going after physicians, chastising them and disciplining them because they supposedly weren't giving enough opiates. I don't know enough of the specifics of those cases to say whether they were right or wrong. But all I do know is that medical boards, and in particular the Federation of State Medical Boards, were pushing opiates quite heavily at that point in time. Now, let's start off with the Federation of State Medical Boards. The Federation of State Medical Boards sounds like it's some, governmental title, federal title of some sort, and they're not even anything close to that. Basically what they are is a lobbying firm. They have a 501c6 status. 501c6 status in the nonprofit world means that they can take in contributions, donations, what I like to refer to personally as bribes, and they can take those in. They have to report a gross aggregate amount, but they don't have to say exactly who those came from individually, or what address they came from individually. So all they have to do is just give us an aggregate amount of how much they receive. That's concerning right then and of itself. I don't understand how a nonprofit group can take in money. They're allowed to do lobbying. That's the biggest portion of what a 501c6 does. So they're allowed to lobby, I guess, they say they're doing it for the safety of the public, and they say they're doing it for physicians. But it seems to me it's more so for themselves and the medical boards and the people that bribe them. And we'll get into some specifics of that here in just a second. Again, they're a 501c6. They don't have to report any specifics. They can actually donate to political campaigns, whether it be for a particular issue or whether it be for a particular candidate. They can, donate for or against that. Now, they do have to report the amount that they did donate. They are taxed on that money. Otherwise, as a nonprofit, they're not taxed at all for doing any of the lobbying that they're doing to senators and to other governmental bureaucracies to get things into a position such that it works well for them. So in 2012, the Senate Finance Committee sent the Federation of State Medical Boards a letter with a number of different questions. Actually, there were 6 different questions. And the first question that they asked of the Federation of State Medical Boards was that they wanted a detailed account of payments, which again I call bribes, from the opioid producers, manufacturers, marketers, etc., that had a relationship with the Federation of State Medical Boards. Number 2, they wanted to identify donations, again, I'll use the word bribes, used to produce Dr. Scott M. Fishman's book. Number 3 is how much revenue was produced from Dr. Fishman's book. Number 4 was identify the states involved monetarily and the number of books that were distributed to these states. Number 5, the Finance Subcommittee wanted to know the names of all the entities involved in writing or editing Dr. Fishman's book and any money that was related to those activities. Number 6, they wanted the identity of any employees at the Federation of State Medical Boards that were involved with the production of this book in any way, shape, or form.
Unfortunately, we'll never know the answer to these questions because all the records were sealed by the Senate Finance Committee, in particular Senator Orrin Hatch and Senator Ron Wyden.
And they have subsequently, since then, 7 years later, have not in any way, shape, or form made it seem as if they're going to move in any direction to making that information available. That's quite concerning. I'd like to know why that is. I know that a lot of these senators receive, again, I'm going to use the word bribes. They call them campaign donations. I don't know. I come from a more realistic standpoint, you might say. So they're bribes. I mean, when a company contributes to a senator or any political individual that's running for office, it's a bribe. They want something done. It's a quid pro quo. They want something in return for the money that they're giving them. So I don't know if that had anything to do with the two senators sealing these records, but it certainly weighs heavy on my mind that probably played greatly into their decision. And I guess the first thing to do, and maybe we'll do this on a later program, is we'll start looking into who Ron Wyden and Orrin Hatch received campaign donations from in 2012 and 2013 and thereafter. And I bet you're going to find pharmaceutical companies or some type of company that's related, some type of conduit, organization, etc. Citizens for Better Medicine, those kind of titles that they like to give to these organizations to, con you into thinking that they're, working for the good of the public and for the country.
Why Ron Wyden, who is supposedly such a champion of the health of the public and especially of seniors, and why he doesn't want this material released, why he's covering it up, why he's hiding it. It's really hard to say, but it doesn't speak highly of Senator Wyden, but it speaks volumes of him as far as his conduct as a senator, and also just his, what are his real concerns about the public? Obviously, none. Mr. Wyden's office has been contacted over the past 10 years about what's going on at the Oregon Medical Board and medical boards across the United States, in particular in regards to how they're utilizing the Healthcare Quality Information Act of 1986 that he is the father of. He wrote that bill, that act that was ultimately passed by Congress, which eventually was signed into being by then President Ronald Reagan in 1986. So in addition to the Federation of State Medical Boards being questioned by the Senate Finance Committee, there were a number of other entities that were also questioned. These entities were the American Pain Foundation, the American Academy of Pain Medicine, the American Pain Society, the Wisconsin Pain and Policy Study Group, and the Center for Practical Bioethics. Now, the American Pain Foundation, once this investigation got started, actually closed down secondary to financial problems. 90% of the American Pain Foundation's funding came from drug and medical device companies. So they were funded approximately $5 million a year, and almost 100% of that came directly from lobbyists. The American Pain Foundation lobbied for opioids, whether right or wrong. Again, I'm not here to make that decision. I'm just passing out the information of what has occurred. The American Pain Foundation also had board members that had strong connections with Big Pharma and extensive ties. Companies that were questioned by the Senate Finance Committee included Purdue Pharmaceutical, Endo Pharmaceuticals, that's ENDO, and Johnson & Johnson. We've all heard of them. Also of interest is that Dr. Scott Fishman, and again that's Fishman, who was associated with UC Davis. In 2013, in fact on April 18th to 20th, when the Federation of State Medical Boards had their 101st annual meeting, Dr. Scott Fishman was given an award by the Federation of State Medical Boards. All this while they were being investigated by the Senate Finance Committee. Dr. Fishman received this award for writing 2 books. The first one was written in 2007. It was called Responsible Opioid Prescribing. The second one was a follow-up book written in 2012. It was also called Responsible Opioid Prescribing, A Clinician's Guide. Dr. Fishman worked very closely and lectured for these pharmaceutical companies. In other words, he basically was paid to lobby physicians for the pharmaceutical company. He'd go and lecture the doctors. He would give his feelings, I don't know, based upon his own perceptions, his own experiences, or were those something that were put in front of him by the pharmaceutical companies for him to parrot to his peers, i.e. doctors, which got, unfortunately, many of them into trouble later on. The Federation of State Medical Boards stated during the time that the second book was being produced that they would need $3.1 million to get the word out about safe use of opioid analgesics in treatment of chronic pain.
We don't know what the medical boards did with those books. We don't know what they charged to distribute them. We don't know in any way, shape, or form what things cost and what they didn't cost. We do know that Dr. Deborah Grady, for the University of California, San Francisco, who's a professor of medicine, at least she was there, back in 2013, stated she feels like the Federation of State Medical Boards contributed to the opioid crisis. Again, whether they did or didn't is beside the point. And again, I'm not arguing here whether opioid use is good, bad, or indifferent about it.
Also of interest is that the University of Wisconsin Pain Group received $2.5 million from Purdue and other pharmaceutical companies that produce opiates from 1999 to 2010. The head of the Federation of State Medical Boards, their CEO, is actually a medical doctor, Dr. Humayun, Humayan Chaudhry, Chaudhry. In 2017, which is the latest information that I have from their 990 forms, he was paid $686,000 to be the CEO of nothing more than a trade association that collects money from, or again, collects bribes from companies, some of those being pharmaceutical companies, obviously. Who knows from who else? Because we don't have access to that information, being that it's a 990 form, and they are a 501c6. A 501c6 being that they can lobby, and they don't have to say who they get their money from. They don't have to give the address of where they get the money from. They don't even have to give specific amounts of the money that they received. All they have to do is post an aggregate amount of money that they received. And in 2017, they received over $55 million into a 501c6. So where do you think most of that money is being, what do you think most of that money is being used for? Obviously for lobbying. What else would it be used for? It doesn't cost $55 million to run a private trade association. They don't do enough to necessitate that. Although I don't know what the rest of their salaries are like. I saw some of the additional salaries that they're paying some of their other administrative people, and yeah, they're in they're in the $200,000 to $300,000 range, and Dr. Chaudhry is around the $700,000 range. So maybe it adds, maybe with just all their employees, it adds up to quite a bit of money. But to me, it seems that they're most likely using most of that money to lobby. And what are they lobbying for? Well, obviously they're lobbying for themselves and for the people they represent, which is not doctors as a whole. They're representing the ones that adhere to their beliefs, that adhere to the organizations they believe in, that adhere to basically what they're told to do.
I'd like to speak somewhat from a patient's point of view. There's a lot of folks out there that have chronic pain. There's been a lot of difficulty with treating chronic pain because number one is physicians have no idea what they're doing. There's some that say that they do, and even these chronic pain specialists really don't know about treating chronic pain. They don't know about alternative treatments. They basically follow some algorithm that was put together by some group of individuals, probably some of them involved, dictating what doctors have to do and what patients have to follow. So we've got a lot of good people that were started off on opiates. And as a result of the pushing of the opiates, in my opinion, to some degree, or to a moderate degree maybe, inappropriately. And so now you've got patients that are, not necessarily psychologically addicted, but they're physically addicted. There's a big difference. These people become physically addicted because it replaces their normal endorphins. They no longer need to make those, manufacture those. And that's why when you stop these medications, people go through withdrawal. People don't usually die from withdrawal. It's very uncommon, but the folks that I've spoken to over the years, I guess it's one hell of a ride. The anxiety in particular is what's real bad. Forget about the nausea, the vomiting, the diarrhea, the chills, and all the other fun stuff that goes along with opiate withdrawal. It's supposedly the severe anxiety. They describe it as like wanting to just claw their way out of their skin. And that's what usually draws them back into, putting the opiates into their body again. So you've got a group of people that are physically addicted and in chronic pain. And then all of a sudden, they're being told that they either have to cut back or they've lost their doctor who was prescribing them because here in Oregon, Oregon Medical Board came after those physicians. Physicians that he initially told to give more opiates to, all of a sudden they said, we're giving too many opiates. So there was a number of chronic pain physicians or physicians that dealt with chronic pain patients, may not have been their entire practice, but part of it, that unfortunately were attacked by the Oregon Medical Board. And many of them have lost their license or have been they've been just run into financial ruin, psychological and emotional torment, distress and destruction, families destroyed, all the good stuff that goes along with what the Oregon Medical Board likes to do to their licensees that for whatever reason they take a disliking to. Again, we're not saying that some people didn't do some bad things. There are some doctors out there that have definitely been up to no good. But again, that is not the common denominator. That is not, it's just not it's just not what typically occurs. Most doctors are not bad doctors trying to addict their patients. They're trying to do the best that they can for their patients. So some of these doctors, I've had personal contact with them over the years. They're good docs. They're good docs. I mean, if the Oregon Medical Board wanted them to change something up, then I'm sure they would have been more than happy to do that, to have had, their lives hassle-free, maintain, their license and not be destroyed, as I said, psychologically, financially, emotionally, socially. It's horrific what occurs. The number of people I've spoken to over the years, they're on the verge of suicide, some of which have committed suicide. Anyways, as far as these chronic pain patients, what are we going to do in our society? Again, the medical schools don't teach you how to treat chronic pain. You don't learn it in some CME course, continuing medical education course. You don't get it from some organization that tells you, the appropriate way to treat or not treat chronic pain. You don't get it in residency or internship programs. We used to have patients that had, when I was a medical student and intern and resident, I was down at Harbor UCLA, a county medical hospital, one of the 4 in Los Angeles. So we had a pretty broad population, I will say. But obviously we had a significant black population, and within the black population, as most people know, there's sickle cell disease. Now these poor people, in fact I remember one a resident, a surgical resident, he was a funny guy. He was a big Deadhead fan. But anyways, he said if sickle cell disease was a white man's disease, it would have already been cured. Now, I don't know if that's true or not. I just thought it was an interesting comment that he made. But what I will say is that the way that we treated these folks for chronic pain and the way that we treated them psychologically was torment, and as I later found out, was disgusting. As I learned more about these opiates, and I learned a lot of it as a hospice medical director when I started up the first hospice for San Luis Obispo County.
So they were being given the medication every 4 hours, which would, relieve their acute pain for a short period of time to some degree, but never really get rid of the pain, or you never really get rid of pain completely, but at least get down to a tolerable level. But they'd be given this medication every 4 hours. It would last about 2 hours, so they're on quite the roller coaster. They'd be, in acute pain. They'd get the shot. They'd start to get some relief, and at the end of 2 hours, it would start to wear off, and then they would start going back into their acute pain situation again. And then they'd have to wait an hour and a half, 2 hours for another shot. Then they'd be called drug addicts, drug abusers, all kinds of different names, when in reality they were nothing but acute and chronic pain sufferers that weren't being treated appropriately by the medical system. And that didn't have anything to do with the facility I was at. This is what was going on across the United States. And it's going on today. The majority of your doctors, 99% of them, have no idea about what pain medications really mean, how they really work, how they should be given, why they should be given. And they're hurting the profession of medicine as a whole, but in particular who they're really hurting are the patients. And I don't blame the doctors completely. Again, as I said, the Oregon Medical Board, and I assume other medical boards across this nation, push doctors to push opiates. And then when the news started tightening around the medical boards and the Federation of State Medical Boards' neck, what did they do? They went after the doctors. They used them as sacrificial lambs to say, see, look, we're controlling opiates. Look what we're doing. We're getting rid of these bad doctors, these prescriber of pain pills. And what did that ultimately do? It hurt the patients. Because then the patients were either cut off by their doctors, cut off because the medical board had either restricted or revoked or suspended or whatever they decided to do to the doctor's license so they could no longer give these patients pain pills anymore. It's a pretty sad situation. And it's so sad that the medical board, in addition, where they're going after one of these doctors, they take it upon themselves that all of a sudden they're going to prescribe, they're going to treat these chronic pain patients. Well, they've never seen them, they've never spoken to them, they've never obviously examined them. Yet here they are making decisions based upon, I don't know, what, old chart notes? Doesn't make a lot of sense to me. In fact, that is illegal and should be taken to court by somebody. And that's one reason why I want chronic pain patients or just patients in general that have been hurt by the Oregon Medical Board to come forward, because it's time to start attacking them. They are the problem. They are the head of this octopus with all its tentacles, at least here at the state level. Now you get out to farther, you get up to higher levels, you got the Federation of State Medical Boards. You get above that, you got government involved. Don't think that government isn't getting kickbacks in some way, especially your elected officials. That's one of the things we're going to start looking at. We're going to start looking at Ron Wyden and Orrin Hatch and maybe some of the other politicians and where they get their money from. Because I guarantee you that they're getting it from pharmaceutical companies. They may give them a tongue lashing out there in public, but behind closed doors, they got their hands out, and they're more than happy to take a check from these pharmaceutical companies.
And the same thing's happening today. It's not just happening with sickle cell patients. It's happening with any patient that has chronic pain. No matter what race or religion or sex you are, it's happening across the board. So here we have patients in our population now, and they'll get a little bit of Vicodin, which is hydrocodone with Tylenol, or they'll get a little bit of Percocet, which is oxycodone with Tylenol. And the way the doctors will prescribe it is they'll say, oh, you can have 4 tablets a day, or you can have a couple of them every 6 hours. Well, again, we run into the same situation. These people never get to a steady state level so that they can, have relief of their pain. They're always just barely getting above it before it's starting to wear out, and they're starting to, metabolize the drug, and it's starting to diminish. The levels are starting to diminish in their system. And then they've got to, make it through a number of hours with increasing pain. So what do we see patients doing? We see them overusing their medication. And again, this isn't just with, the simpler drugs like Percocet or Vicodin. It's also true for things like OxyContin, where it's prescribed twice a day. And probably should be more, definitely 3 times a day, maybe even 4 times a day if you really look at the pharmacokinetics and pharmacodynamics associated with that drug. So again, we have this population of people that now have an addiction. Some of them have had to kick the addiction. Some of them have had to go to the street to get additional opiates, which is another very sad and disturbing story that we're not going to go into today. And we've got doctors that are under the boot. The boot is on their neck from the medical boards. And in particular, again, I can speak to the Oregon Medical Board and what I've seen and how they treat people, how they're treating doctors and other licensees that they oversee. So how are we going to treat these folks? How are we going to treat these chronic pain patients? Are we not going to give them any opiates? Well, the medical board says you can have opiates, but you can't have marijuana in addition. So what I found was that a lot of patients were doing quite well with adding cannabis, and probably the addition of CBD in addition, but initially it was just cannabis. We had the medical marijuana. So people were starting to use medical marijuana. They were going down on the amount of opiates that they needed per day. But the medical board came along and said you can't use both. The medical board says you can take a bunch of other types of drugs together, but God forbid you add a little cannabis in with opiates. Now, I've never seen where there's been any problems with those two mixing. Maybe it might make someone a little drowsier. Most likely not. Most people have developed tolerance to the opiates, and they also develop tolerance to the cannabis, to the THC. So, again, what I saw were people that were getting relief, getting off a lot of other medications, reducing their dosage of opioids, and living a much, much more comfortable life. But, again, the medical board came along and made sure that didn't happen either. So what are we going to use? We're going to just throw things like gabapentin, which is known as Neurontin, at them, muscle relaxers, other medications that we use for seizures or for psychosis, like Abilify or amitriptyline. Those really what we're going to be giving to people to help with their chronic pain, because what we need, forget about a governmental task force, we need an organization that starts delving into this. If we're going to depend upon the government, we're in deep trouble. The government never solves any problems. I don't care what it is. They're not going to solve the problem. It's not part of their milieu, not part of the environment that they swim around in. They only make problems. They don't fix them. They tell you they're going to fix them, and they're going to do this, or they're going to do that, and they're going to pass this bill, and then pass that bill. They just pass more and more bills. They never even really make the bills that they've already passed work before they're passing hundreds of more bills every year. So again, I feel for the patients greatly. I don't want to see them losing their pain control. I was at the Oregon Medical Board's public meeting in January, and there was a gentleman that he came to speak at during the public comment period, and I don't know, I would guess he was probably 60s. He was with a walker, obviously had much difficulty moving. And after listening to him speak to the Oregon Medical Board, it turns out he'd had 5 lower back surgeries. And again, my experience shows that surgery, boy, I'd have to be pretty bad off to go to surgery for my back, because I've just seen too many back surgeries that just don't work. Or they'll work initially, and then things just start to deteriorate again from there. And next thing you know, people are on their 3rd, 4th, 5th surgery. Medical board listened to this man, talked to them. He talked about the fact that his doctor, who was not a chronic pain specialist, just a primary care physician, was being investigated by the medical board because of prescribing of opiates. And at this point, what the medical board is doing, at least in Oregon, is that once they're disciplining a doctor, they've got them to sign that stipulated order that gives away all their legal rights that they have. Once they sign that, then the medical board can do whatever they want to them. And what the medical board's doing is they're practicing medicine on patients that they've never seen or spoken to. They don't even really know what's all going on with them other than what their opiate dosage is, maybe some of their other medications. That's illegal. That's illegal. But they're being allowed to get away with it. So that's why I want to talk to some patients. If we could do it over Skype, or I can come to your home and interview you, or you want to come down to the studio and be interviewed, whatever you'd like to do. But I want to get your thoughts. I want to get your feelings. I want to hear what happened to you, what happened to your provider. I want to hear what you're having to do to get by, get through, this particular time in your life, and just get that out on the table. Get that over to the medical board, get that over to the governor's office. I'm going to send these people DVDs. They're going to see exactly what's going on. This is all going up on cable access. It's going to go up here around the Portland metro area. It's going to be spread out from there. It could go to any cable access. If you live somewhere else, in another part of Oregon, or you live in another state, please get a hold of me. Again, you can go to my medical board website.
Now, the frightening thing about these medical boards, Federation of State Medical Boards, your government. I mean, it's basically run by authoritarian bureaucrats, people that don't seem to be too empathetic, don't seem to have much humanity in them, and they certainly don't care about the patients who they say that they're there for the safety of, nor do they care about the doctors, because they let the bad doctors get away many times because that's their friends and their buddies and their associates and their partners. So who do they go after? They go after the doctors that are in small groups or solo, that don't have anybody to backstop them. And they use these doctors as sacrificial lambs. So these doctors are the ones that they throw out so that they can have their buddies maintain their licenses. And there'll be future podcasts on some of these specifics. And they're pretty ugly. This is public knowledge. None of this is being made up. This comes directly from the medical board's website. And as little as I trust the medical board and what they write, some of this stuff is true. There's no ifs, ands, or buts about it. There's no way to get around someone's death and why it occurred. Why someone leaves someone's office with a blood pressure that's documented at 80 over 40 and a pulse of 130. They're sent out and they end up at the emergency room 3 hours later and they die. That kind of stuff isn't made up. As far as some of the other things that the medical board writes about, a lot of it's you got to take with a big grain of salt. What's the future of pain control in this country? That's a very good question. I don't think anyone really knows at this point in time. I think that it's very easy to make decisions or algorithms, etc., as far as what direction pain control should go to. But the powers that be are being influenced, as I said, by drug companies, by public groups like Public Citizen, by a number of different entities, pharmaceutical companies, insurance companies, all kinds of different government entities and private entities, etc. What do I see as the future of pain control? Where would I like to see it go? Well, I'd like to see opiates used much more sparingly, because I think that ultimately they don't have a long-term beneficial effect for everybody. People develop tolerance and then they develop side effects, in particular constipation, from these medications. Not to say they shouldn't be used. I'd like to see them where they're used in a more acute setting so that the patient isn't on them all the time, where if they have a flare-up, then they can go to their opiate. But then again, some of these folks obviously do quite well with daily opiates. They seem to live a better life. They certainly don't seem drugged up. They've developed tolerance to the medications, so it doesn't affect them as if it was someone that just went out to a party and someone gave them a pill and they took it and they had that kind of effect. So again, I think each individual case has to be looked at. It can't be some blanket proposition or algorithm, etc., where one size fits all. It's not going to work that way. I mean, I have my opinions of what I'd like to see done. And again, I'd like to see opiates used more sparingly. But that doesn't mean I don't want to see them used. And it certainly doesn't mean that I don't want to treat people's chronic pain. So what do I propose to add or use in place of opiates? Well, the one thing that I saw that was extremely beneficial was THC, cannabis. And now that there's much more information about CBD, cannabidiol, I think that that is also an additional choice that needs to be thought of and used. Are there other things that we could be using? Oh my goodness. Out in the herbal world, there's a plethora of different herbal options for us that are non-addictive and that are quite effective with pain. Whether those will be allowed or not, that's another story altogether, because the medical boards and the powers that be don't want you using alternative herbal medications. They want you using their pills. So what they want you on is, well, maybe opiates, depending on what the situation is. They want you on muscle relaxers. They want you on what we call neuroleptics that are used for seizures and used for, psychiatric disease like schizophrenia or someone, or for bipolar disease. Things like Abilify or Neurontin. They want you to use a toxic soup of drugs that are not of any benefit to anybody. They do nothing but cloud your mental capabilities, and they are dangerous. Those are the kind of things that when you start giving to folks, they don't develop a tolerance to those. Next thing you know, they're falling in their bathroom and cracking their head open on the sink or the toilet. It's one of the biggest ways that older folks die, is falling in their bathroom. There isn't a lot of room there unless you have a big house. And so, when they hit the floor or they hit, some object like the toilet, it kills them. Again, very, very common way for older folks to die. So again, I don't have the answer for what the future is specifically, because I think that it has to go on a case-by-case basis. But I do know that if the powers that be really wanted to help folks, there'd be a lot more thoughtfulness about what could be done, or what should be done, or what will be done, than what has been done. Right now, chronic pain patients, they're on their own. You're literally on your own. Unless surgery can help you, and many times surgery makes things worse, in particular back surgeries, surgeries for adhesions inside the abdominal cavity, those kind of problems. But usually surgeries don't necessarily make things better. For the majority of chronic pain patients, it makes things worse. So, again, we need to have somebody other than the usual players that are sitting down and making some decisions and having some thoughtful discussion and having some trials with some of these alternative, in particular, herbal medications. There's biofeedback. There's nerve scramblers. I mean, there's all kinds of things that are available out there. But many of these things are not available to the average person. Number one is their insurance won't pay for it, and if their insurance won't pay for it, many people can't afford it. If it was a one-time thing, like penicillin for strep throat, yeah, it might work. But not when you have this pain day in, day out, hour after hour. That kind of tact is not going to work well for the typical person with chronic pain. Doctors have been destroyed by what these medical boards and the Federation of State Medical Boards are doing. And when the doctors are destroyed, the majority of them do not seem to have the intestinal fortitude to move forward. They're destroyed emotionally, socially, psychologically, and financially. Their families are destroyed. Many of them are committing suicide. Most of them are contemplating suicide, if not routinely, then at least on occasion. They find themselves unable to get jobs because of this black mark that's been put, or scarlet letter that's been placed upon them. I mean, even simple jobs, like getting a job working as a school bus driver. I've seen where folks have looked for jobs in all areas. And once they find out about, when they see things like unprofessional and negligent, right away they turn away from that applicant. So even simple, low minimum wage jobs are difficult for these doctors that have been destroyed for them to be able to get. What's going to make the change is not going to be the doctors. The doctors play a part in this. But what's really going to make change is going to be the public. It's going to be these politicians' constituents. And for what I've seen and what my experience shows, these politicians could care less what you think or what you feel or what's happening to you. Same as the bureaucrats that are unelected. They don't care about the public. They're not there for you. They're there to make sure that you pay your taxes, and they're there to make sure that you follow their directions, and they're there basically just to have a job that's, well, as we say, it's government work. It's typically halfway done, half cooked. There's another term that we use. I don't know if we should use it here, but it's government work. And at best, it's 50% of what it should be, at best. So until patients get involved, and that means lawsuits, and in the first podcast we talked about that. I spoke about the North Carolina Dental Board decision and how important that is, especially not only for licensees, but for the public. As I've stated before, the public is getting the short end of the stick. They're getting the short end of the stick in regards to chronic pain treatment. And they're suffering. They're suffering greatly. I've spoken about a gentleman that was at the last medical board meeting, the Oregon Medical Board meeting, and how he spoke to them. They looked at him with just blank eyes, uncaring, didn't ask any questions, didn't want to know anything about it. They don't care. They're not there for the safety of patients and the well-being of patients. They're there for authoritarian control. They're there to bring in whatever system they think it should be. They're there to get rid of people that they don't like for whatever reason in regards to healthcare licensees. That's what they're there for. They're there for the exact reasons why the North Carolina Dental Board decision came about. Because they are a private trade association, these medical boards. And because they're a private trade association, they're not there for the well-being of the licensees. They're there for the well-being of their own, their friends, as I said before, their partners, their associates. And the only way that this is going to end is if the public starts bringing lawsuits to the forefront and calling these medical boards out on what they're doing to their doctors. Again, when this gentleman came in to speak to the medical board, his doctor, from what I could ascertain, was a primary care physician of some sort, was not a chronic pain physician, and was helping this gentleman with his chronic pain. And he looked to be in absolute pain. And obviously he was not getting the amount of medication that he needed because he stated as such. He's getting a couple of Vicodin or a couple of Percocet every 6 hours. I mean, that doesn't get anyone out of pain. In fact, I really wonder if it's even worthwhile taking something at that point. It certainly is not strong enough, nor is it have a long enough half-life within the body for it to keep pain under control the way that these doctors are telling the patients that it's supposed to. So I find the patients at the very bottom of the hill, as far as, and you know what rolls down hills, and so they're at the bottom of that hill. And the doctors are maybe somewhere in between, but the doctors are taking it out on the patients too. Doctors are not allowing the patients to have medical cannabis. Now it isn't such a problem. Patients don't need to go to a doctor to get medical cannabis. But if they're getting some pain pills and they're going to get drug tested, they're going to come up positive for marijuana at some point. And then the doctor's going to cut them off from their pain pills too. Now, me personally, I saw how advantageous medical cannabis was for patients. When I first started helping out an organization called Voter Power, I was amazed talking to these poor people. I'm not saying that there weren't some that were abusing the system. There's always going to be folks that are abusing the system. At this point in time, it really doesn't matter. I mean, marijuana is basically legal in this state and probably and soon to be across most of the United States, if not all the United States. It's a low priority and a low problem considering all the other concerns that we have here in this country. So when I was helping out and was willing to sign patients what they call physician statements for the Oregon Medical Marijuana Program, I saw great benefits. I saw people cutting back on their medications, whether it be their opiates, whether it be muscle relaxants, neuroleptics, whatever it might be. They were able to cut back. They were able to live a much, much more comfortable life. Some of them got off their opiates completely, which was amazing. And some of these people are on some pretty high dosages. People that are on these opiates really don't want to take them. They take them because they have pain. And some people do better with pain. Some people don't do as well. Everybody, pain is a very subjective thing to experience. I know for myself, I've seen a lot of patients with horrific back pain. They've never had any surgeries, but I've seen their x-rays and they don't look good. Then again, I've got some significant back problems myself. I know my L3-4 disc is completely gone, probably from a fall I had, slipping on an icy step. But I was having pain down my left leg. I started stretching. Stretching seemed to give me more relief than anything else. In fact, it's been amazing for my back. And some of the other things I've done too have come along and helped to some degree, but no doubt the stretching was by far and away the most important thing I could do. But again, as far as the cannabis, I came in and I started helping folks with that. I felt very proud. I felt incredibly happy to be able to bring such relief to folks that have really at that point nothing in their lives. They're destitute. I mean, they can't work. Some of them, many of them were on disability. Some of them were trying to get on disability. Some of them aren't allowed to be on disability for whatever reason because of the federal courts. But I felt very proud, and again, it made me feel good inside to be able to do something for these folks that no one else was willing to do. These people lived out, many of them in rural areas, so they would drive in 5 or 6 hours. I mean, they would wait a whole day to get this process done. They were all very frightened. They didn't want their doctors to know about it because their doctors, most of them either did not believe in medical cannabis or they were frightened of the repercussions that it might have at the federal or state level in regards to their lives. So these folks had to keep it on the down low because if you're out in a rural area and you lose your doctor, there may not be a doctor for hours away, if you can even find one then. You might have to come in from someplace like southeast Oregon all the way into Medford, or maybe even someplace like Portland to get medical care. It's that bad. And with a shortage of physicians out in the rural areas, it's even worse. There may be one doctor for an entire area. If that doctor doesn't agree with the medical cannabis, or they're frightened of it being used by the patients, especially in conjunction with an opiate, they're going to put their tail between their legs and run and hide. Because the medical board has made it quite clear they are not going to allow the simultaneous use of marijuana and opiates, even at minimal amounts for either one and a larger amount of the other. So a small amount of opiate being used with the medical cannabis is not allowed, or a small amount of the cannabis along with the opiate is not going to be allowed either. They made that very clear. They've stated that in their own public meetings. So I helped these patients. They were oh so thankful. And to have someone be so thankful for what for something so small that you've done for them makes you feel awfully good inside. Again, all I had to do was go through their records, do an exam that, the state doesn't require a detailed exam. They just want to know whether or not that person has what they say that they're having. So you got to review their records. You got to do an exam that documents, what they are or aren't experiencing. And then you sign their physician statement, which they send it to the state. And the state sends back to the doctor eventually just to sign to say, yes, this is my patient, or that I've seen this person. They even eventually stopped doing that for me because I guess my paperwork was stellar enough for the Oregon Medical Marijuana Program. They saw no necessity in continuing to send me those letters. It was pretty thorough what I was doing, contrary to what the medical board likes to say. I did things thoroughly. That's the reason why I got in trouble, because I wouldn't sign someone's physician statement for the Oregon Medical Marijuana Program. They didn't qualify. They didn't have the disease process that they stated they had, that I could see from the records that they had brought. The records they brought initially were from an urgent care, and they were the original documents. So I suspected they were probably forged. And again, those documents were never seen again after that day. And then it took me 2 years, after the medical board came after me, it took me 2 years to be able to get any records whatsoever. And this is after they've forced me to answer questions that they've had. They forced me to go to what they call they invite you to what they call an investigative committee meeting. What it really is, it's a forced interrogation where you're not really allowed to answer questions. You're basically told what you've done wrong, and you're basically expected to just acquiesce and say, yes, I did those things wrong. Now let me sign a stipulated order which signs away all my rights, especially my legal rights. Well, I certainly didn't do that because that's not the game I'm going to play. I didn't do anything wrong. I did everything right. I tried to educate them about it. They don't want to be educated. They want you to acquiesce. They want you on your knees. So the person that I saw, again, they supposedly had gout. They've been seen 7 times in 20 years for supposedly what the medical board called chronic severe gout that was recalcitrant to treatment. Well, the only treatment supposedly this person had was a couple of weeks before they saw me with a drug called allopurinol. Supposedly they had a reaction to it, so they had thrown it away because they only lived a few miles from where this office was at. And I asked them to go grab the bottle so I could see it. Also, I asked them which pharmacy did they get it at so I could verify that they had actually even gotten it, because I had no records to show that they had gotten any allopurinol. There was nothing at all that was brought to me. They couldn't remember the pharmacy that they had been at in a small town like Medford, that they just gotten it 3 weeks prior. And then they tell me, oh, they didn't have the bottle anymore because they had a reaction to it and they threw it away. But somehow that bottle appears 3 years later. Looks like it's brand new. And the strange thing about that bottle is I had called that pharmacy directly at some point before my hearing. And I have documentation from that pharmacy showing that that patient never received a prescription from that pharmacy, ever. So where that bottle came from and how it got there, well, all I can say is that there's some nefarious activity going on, and I have a sneaking suspicion that the Oregon Medical Board and Assistant Attorney General Warren Foote had something to do with it. I can't prove that, but I'm pretty sure that's what's going on, because we had asked Attorney General Warren Foote and the Oregon Medical Board specifically for discovery. Anything that would help us in regards to finding out what was, in regards to, the hearing. So we would be prepared for it. And they say you don't get discovery. So here's one person that tries something devious. This individual not only was devious with their records, but they also took another patient's records and then tried to come back. Some of them had bilateral knee pain that obviously had significant, arthritic changes in their knees, horrible changes. And then this patient that had the supposed gout tried to come back and get his Oregon medical marijuana paperwork put together based on that other patient's chart notes that he had taken from the clinic and he had filled his name in with, full well knowing that those were not his records. Obviously, he did not have bilateral chronic knee pain. That wasn't why he was there. He came there for gout. And to say that he had significant, severe chronic gout when all he had was 7 visits, one of which in those 20 years might have been consistent with gout, and that's it. One visit out of 7 in 20 years. No workup of any note, no appropriate treatment, nothing appropriately done for this gentleman whatsoever. I never told him he couldn't have a signature. I said he needed to go back and see his doctor and get further workup. His money was given back to him. He didn't lose anything but some time and the small amount of money he paid to drive 3 miles and back in regards to gas. But the Oregon Medical Board wants nothing to do with that. They want nothing to do with medical marijuana. They don't really want people using it now. They are against it. They'll tell you otherwise, but they're against it. They don't agree with it. They don't think it works. They think it's just people trying to get high. Okay? That's what people want to do. Hey, they're legal to do that now, right? They can get as high as a kite if they want to. I certainly see that as a much better way to alter your consciousness than something like alcohol or cocaine or methamphetamine or ecstasy or LSD or a lot of the other stuff that's out there is just frightening, really, in regards to what it does to the human body and human beings. So again, we're going to close down this podcast. I'm looking, again, for patients that have had problems in regards to their doctors and or the Oregon Medical Board regarding chronic pain issues. If you have other things you want to get in contact with me about, please do. You can see on the screen, you can see my website. Again, this podcast will be posted there. Cable access, YouTube, Vimeo, band.video. There's a number of different places it's already been posted at, the first one. And again, it's going to be at my website, drdovervsomb.weebly.com, as you see on your screen. You can go there. You can get all kinds of information. It's frightening what's going on in this state. And in future podcasts, you're going to see something that's even more frightening than that. You're going to see how your information is being sold. You're going to see how, and I'm talking about your medical information, your medical costs, your medical bills. You're going to see who's involved. You're going to see who's involved with this situation, the politicians, the government agencies, the private companies. This is all coming out. In fact, there's already a lawsuit in the courts about it. The gentleman that is the whistleblower on this has already gone to the courts. But the courts are corrupt, especially the ones here in Oregon, whether it be the state courts or whether it be the federal district court here. They're all buddies. Nepotism, cronyism, money changing hands. You'll be amazed at what you see. But again, please contact me. You can get my phone number. You can get my email address off of the contact page at my website. As I said in the last podcast, I'm more than happy to speak to anybody. But if I receive any abusive calls, any threatening calls, well, appropriate action will be taken, number one. Number two is you'll be blocked. So, but I am interested in those that clearly have problems, have concerns, and want help. We need to take care of this chronic pain situation in our country. We have people that are suffering unduly. Again, I want interviews. I want to speak to you. I want to get you on the air. If you're worried and you want to remain anonymous, that's very easy to do. We have the capability of blurring your face and altering your speech. But we want to hear from you. So take care and look forward to hearing from folks. You all have a good day. Bye-bye.